you guys need to pay attention to is the new concentration. So reconstitute with 3 mils of normal saline, okay? And again, you can have 3 different types of solutions that you can reconstitute with. You can have normal saline, you can have sterile water, and you can have bacteriostatic sodium chloride as well. So make sure you're choosing the right kind. So this one is asking for normal saline. Once we put 3 mils in, it creates a new concentration of ANSEF 500 milligrams per mil. That's what you need to use for your dosage calculation. So why don't we go ahead and do that now? So our dose on hand is our order. So go back to your MAR, your physician's order. So your dose on hand would be 1 gram. Okay. And the new concentration, or the dose that we have on hand, is 500. Did I say that twice?
You said dose on hand.
Yeah, I didn't mean that. I meant desired dose over dose on hand. So the dose on hand that we have is 500 milligrams per 1 mil. Okay. So if we want 1,000 milligrams, it comes in 500 per 1. We're going to pull 2 mils out of the vial. Okay. So again, 3 mils are going to go in. We're going to make that liquid. As soon as we do, it's going to create a new concentration of 500 milligrams per mil, and we want 1,000 milligrams, so we're going to take 2 out. 3 in, 2 out. Okay? I made sense there, right? Okay, perfect. All right, so I'm going to go ahead and do my second check before I mix this. So I have Catherine Canador. I have ANSEF, and I have ANSEF. 1 gram IV TID. I'm going to double check my math. Okay, and everything looks good. And I'm going to go ahead and I'm going to start to mix. So make sure that you have the right solution. So I have normal saline. Okay. You pop the caps off. Remember, you don't have to sterilize them unless you touch them. I like to use a blunt tip needle. You can use the needle that comes with the 3 mil. I just find the blunt tip a little bit easier to work with. Okay, maintain sterility while you're putting your needle tip and your needle together. I need to pull back 3 mils. And I'm just gonna safely recap. And then you need to spend some time mixing this. You can flip it upside down. You need to make sure that the liquid gets all of that powder. Sometimes, depending on the medication you're mixing, it might take longer for some than others. What you want to avoid is just vigorously shaking it. You can create a lot of bubbles and a lot of foam. So just make sure you're rolling it, or you're just sort of gently mixing it until it's completely diluted. Okay. I don't do my third check now. I wait until I have it up in the syringe. I think it's safer that way to make sure that you actually look at the dose in your syringe before putting it into your mini bag. So don't bother to do your third check before it's in there. Okay, so it's all there. You do not have to re-put air into your vial to get your dose. You can, however, you're going to get a lot of positive pressure if you do. You'll notice, because we put fluid in here already, that as soon as you put your needle in, you're going to get a bit of positive pressure. So it's up to you and what you decide. Just know that if you go in and you take it out and you're working with your syringe a lot, you run the risk of this solution squirting out of the vial. And then if you require the full dose, then you might actually be missing some. So I just want you to be conscious of that. So I do not like to put in air, just uncap. Okay, and I'm going to pull back 2 mils, not 3. So remember, your doses will be different, or your measurements, I guess. Okay, so now using my syringe and my vial, I'm going to do my third and final check before I go and I put it into that mini bag. So I have Catherine Canador, I have ANSEF, and I have the right drug. 1 gram, I double checked my math, and it was 2 mils, and I definitely have 2 mils in my syringe. It's IV TID, and it's for an infection for my patient, and it makes sense to why she's getting that. I don't think I said that during my second check, but we're attending to it now. Okay, so now I can get rid of this, so I can put it into the garbage, or I can put it into medical waste. It's not multi-dose, so you need to get rid of it. Okay. Next, I have my mini bag. Again, just double check. I like to just hang it off the end of a surface, the table, the med cart. You have 2 ports. So this port is the port you're going to spike when you actually attach it to the mini bag with your tubing. This one is what you're actually going to inject the medication into. You need to swab it. This needs to stay all one closed sterile system, okay? All right. So from here, you just want to spike the bag, okay? Get your fingers out of the way, and then you're literally just going to inject it into the bag. If you want, you can aspirate back, okay, and then push it back in, making sure that it's all been mixed, and put it into the bag. I'm done with my syringe, so I can go ahead and put it into the sharps. Okay, and I'm just gonna gently mix this. Do not leave this bag. You need to make sure that it is labeled, okay? You can fill out your label beforehand so that it's ready to go, so that the second that it's mixed, you can just go ahead and put it right on there. I'm just gonna run through it with you. So the patient would be Catherine Canador. The drug would be Ansef. The amount is something that students tend to mix up. They want to put the volume in mils, so they would put 2 mils. That's not right. I would rather you actually put the full dose. So you're gonna put 1 gram, and you can put 1 gram per 2 mils if you like, but do not just put 2 mils, okay? Next, you're gonna put added by, that's just your name and your designation, the date, and then there's the expiry date. So that's when I have to go back, okay, to my IV handbook data sheet. And this says that it's stable in infusion fluids for 21 days at room temperature. Reconstituted solutions are stable for 24 hours at room temp and 96 if refrigerated. So make sure that you put that 24 hours on the label. The rate, which we figured out, which we will figure out, will have to go on here. And then your base solution is just what is in your mini bag. So here I would put NaCl or NS for normal saline. And then the time I'm not going to fill out now, the time I leave blank until I go into the patient's room and I actually start the secondary infusion. So for right now, leave that blank. I also put it on the back of my bag so that I'm not covering up the label of the front of the mini bag, so it can go sideways, doesn't matter. I just pop it on the back here. Okay, so why don't we figure out our flow rate now so I can add that to the label.